Hey everyone, and welcome. Today we are going to demystify uterine polyps. We're going to break down exactly what they are, the signs you should be looking for, and what your treatment options are, all in a way that's super simple and clear. Have you ever found yourself asking this very question? It's something that can cause a whole lot of worry. And you know what? For good reason. Now, while there are a bunch of different possible causes, today we're zeroing in on a really common one, the uterine polyp. If this question has ever crossed your mind, you are in the right place. Okay, first things first. Before we jump into symptoms or treatments, we have to get a handle on the absolute basics. What in the world is a uterine polyp anyway? Okay, the easiest way to picture this is to think of a small skin tag, but on the inside of your body. That's pretty much what a uterine polyp is. It's just a little overgrowth of the uterine lining, which has a fancy name, the endometrium, that kind of pokes out into the uterine cavity. And they don't all look the same. Polyps usually come in two main shapes. You've got your sessile polyp, which has a wide, flat base, kind of like a little hill. And then there's the pedunculated polyp, which is attached by a thin stalk. Think of it like a cherry on a stem. So what puts you at a higher risk for getting one? Well, it's often tied to hormones, especially estrogen, which is known to encourage tissue growth. That's why some of the key risk factors include being in that perimenopausal age range, 40 to 50, but also things like obesity, high blood pressure, and even certain medications. But hey, remember, these are just risk factors, not guarantees. This brings us to the next big question, right? How would you even know if you have a polyp in the first place? Let's talk about reading the signs and what you should be looking out for. Okay, the number one, hands down, most common symptom is abnormal bleeding. This can show up in a few different ways. Maybe it's bleeding between your periods, or your periods are suddenly super heavy, or it could be any bleeding at all after you've gone through menopause. And hey, here's a really simple trick to remember the main symptoms. Just use the word polyp itself. So P is for postmenopausal bleeding, O is for ovulation problems, L is for large or heavy bleeding, Y is for young infertility, and that last P is for pelvic discomfort. See, a polyp can mess with the uterine lining, which causes bleeding, or it can literally get in the way of implantation, leading to fertility issues. It's just a really handy way to keep those signs top of mind. So, let's say some of those symptoms are sounding a little familiar. What happens then? Well, let's walk through exactly how doctors figure out if a polyp is really the culprit. The diagnosis usually follows this three-step path, starting with the simplest option. First up is a transvaginal ultrasound, which gives a good first look. If your doctor needs a clearer picture, they'll move on to a sonohysterography. This is pretty cool. They introduce a tiny bit of saline into the uterus, which makes the polyp pop right out on the ultrasound screen. And the final, most definitive step? That's the hysteroscopy. And this, right here, is why hysteroscopy is called the gold standard. It's not just for looking. A tiny camera lets the doctor see the polyp directly, in real time, and they have special tools that let them remove it right then and there in the same procedure. This whole see and treat approach is just incredibly efficient. All right, a polyp has been diagnosed. So, what now? Let's dive into the different treatment options and figure out how you and your doctor can decide what the best plan of attack is for you. Generally speaking, you've got two main roads you can go down. If you have a small polyp that isn't really causing any symptoms, your doctor might suggest a conservative watch-and-wait approach. But if that polyp is causing bleeding or other problems, then surgery is really the most surefire way to solve it. And the absolute best surgical option is that hysteroscopic polypectomy we were just talking about. It's considered minimally invasive, you're usually in and out on the same day, and the best part, the chances of that polyp coming back are really, really low. Okay, let's wrap up by tackling some other really important questions that tend to pop up. We'll clear up the difference between polyps and fibroids, we'll talk about fertility, and we'll look at the potential cancer risk. Okay, this is a big one. People get polyps and fibroids confused all the time, but they are totally different things. The absolute key difference is where they come from. A polyp grows from the soft inner lining of the uterus, while a fibroid grows from the firm muscle wall. This is why they feel different and cause slightly different symptoms. Now, for anyone who is concerned about fertility, this part is really important. A polyp can sometimes act like a little roadblock inside the uterus, either interfering with sperm or stopping an embryo from implanting properly. The really good news is that by removing it, you can clear the way and significantly boost the chances of a successful pregnancy. And now, the question that's probably on your mind, what about cancer? It's a totally natural concern, but the news here is actually very reassuring. The vast majority of uterine polyps are benign, meaning they're not cancerous. The risk of a polyp turning into cancer is very low. We're talking only about 1 to 3%. So, while the risk is low, it's really important to know the red flags that mean you should see a doctor right away. Let's be super clear. The biggest one is any bleeding after menopause. That should always be checked out. Other things to watch for are the rapid growth of a polyp you already know about, or just having a combination of multiple risk factors. And that brings us to the end. We have covered so much ground today, from what a polyp is to how it's treated. So take a second and think, what's the one most useful thing you learned that you could share with a friend? Because sharing good, clear knowledge is one of the best things we can do for our health and the health of the people we care about. Thanks so much for joining me.